Hello, I'm Siobhan. I'm the Tissue Viability Lead Nurse here at the University Hospital Plymouth.
And I'm Emma, I'm one of the tissue viability nurses here as well at Derriford.
And this is a video on ASSKING, which is an acronym for our Pressure Ulcer Prevention Key Gold Standard Care Plan, which we're going to run through very briefly for you. The idea of this is to help your care planning, make sure that your documentation is in place, but also just knowing about the key principles of what you need to do to prevent a pressure ulcer in line with your NHS England guidelines and our NICE guidelines. So the first acronym for ASSKING is A, and that stands for your risk assessments. So this here at UHP would be your Waterlow and must on admission, if there's a change in ward or unit, or if there's a change in their clinical condition.
And S is for skin inspection. So skin inspection is really important. So we need to make sure that we're looking from the patient from head to toe and checking that skin and identifying those key vulnerable patients that are at risk of pressure ulceration, and actually looking at the skin and seeing if there's any changes to the skin or if there's any ulceration already there.
The other S is for surface. That's the pressure relieving equipment your patient may be on. It is not going to prevent a pressure ulcer on its own, so it's really important we incorporate all of these other actions, all the other parts of the acronym. But surface is the air cushion, air mattress, or the foam cushion or mattress that they'll be on.
And K is for keep moving. So regular repositioning is really important for our patients. So the more we get those patients turning left and right, lifting those heels up off onto a pillow, it's really important to get those tissues reperfused, as we know tissue hypoxia is the key problem for pressure ulceration.
I stands for incontinence. It's all about keeping the pH level of your skin maintained. Naturally our skin is slightly acidic. When we have fecal or urinary incontinence, it can become a bit too alkaline, and so what we do to try and protect that is we use barrier creams or sprays. The one here at UHP you'll probably know is Derma-S, making sure you're applying that and you're documenting that you're applying that.
And N is for nutrition. So nutrition is really important. If our patients aren't eating and drinking, then they're at risk of increased pressure ulceration. So making sure that you might need to talk to your nutrition teams or getting the dietitians involved. So lots of eating and drinking if possible for our patients.
And the last one is G, which is giving information. This is all around informed decision making for your patient. If they've got capacity, explain to them why the asking is the asking, what it is and why we're asking them to turn, to eat well. Patients need to be involved in this package of care, which is essentially a prescription of their care. If they haven't got capacity, we do this in best interests, but it's really important that we document what we're doing for their best interests. And that's it. I can't believe we did that in one take. So that's the ASSKING model. If you need any help or support with that, just ask the Tissue Viability team and we'll go over it again with you.